We all know rheumatoid arthritis is a systemic disorder characterized by chronic inflammatory polyarthritis, inflammation involving the skin, the eyes, lungs, and the blood vessels. You have a fluctuating clinical course in the form of remissions and exacerbations, and you also have an increased risk of cerebrovascular disease, about a 60% increase. And it's a complex multifactorial pathogenesis. If you look at the molecular level of the disease pathology, you have the activation of the macrophages and the antigens and the T cells. These are the thymus cells, and you have the release of the inflammatory markers, the tumor necrosis factor alpha and the interleukin 1s, which leads to synovitis and production of collagenases and metalloproteinases, and which all are degrading the cartilage of the joint. The osteoarthritis pathophysiology also has the ingredients of the tumor necrosis factor and the interleukins, and also the levels of the metalloproteinases, and this leads to, again, articular cartilage and synovitis. So osteoarthritis is basically an inflammatory arthritis, and that is what has been studied from many papers. This one is from Natural Reviews in Rheumatology. So what does the pathophysiology of both says? That major inflammatory markers are the tumor necrosis factor alpha and interleukins. You have the release of NFKB, that is the nuclear factor kappa B, and it's a transcription factor in presence in all cells. So NFKB has an essential role in inflammatory and immune responses. This all has been, I think, skipped by Dr. Chavan, so that I have to look after. Now NFKB acts as the master switch to turn the inflammation on and off in body. So what are the disorders due to NFKB? So you can have rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, psoriatic and juvenile rheumatoid arthritis. This slides I would just run through because these are similarly shown by Dr. Chavan, and this is showing the translocation of NFKB into the nucleus, changing the gene, leading to the production of enzymes by transcription and leading to the production of inducible enzymes, that is COX-2 and INOX. And this all leads to the inflammation of the synovium, proliferation of synovites, pannus formation. You have increased activity of COX-2 and MMPs, and bone erosions. Now, so what is a newer option available for arthritis for management of NFKB factors? So curcumin is it's a phytochemical compound obtained from rhizomes of Curcuma longa, which is actually in Gujarati is amba hardal. So you eat that and you don't get arthritis, and that's what my grandma told years back, that you eat that and you will not have joint pain. So that is what it proves. It possesses anti-inflammatory, antioxidant, anti-proliferative, and angiogenic properties. Many clinical trials. I won't say that we have authenticated trials in the sense of you having phase 3 with published in journals of high impact factor, but then you have trials of curcumin which controls the master switch, that is the NFKB, and it leads to has multiple sites of action. It first does not allow the conversion of NMDP, prevents that kinase enzyme, prevents its translocation, and prevents the release of inflammatory markers. So what are the evidence suggesting the role in rheumatoid and osteoarthritis? So these are comparative studies with diclofenac, and the outcome was it was as effective and safe in patients with active rheumatoid arthritis. There was a pilot study done in many years back in 1980. This is from Indian Journal of Medical Research. The 18-patient study treated with 2 weeks of curcumin, and it was effective and well tolerated in rheumatoid arthritis. patients were treated with curcumin for 6 months, and the conclusion was curcumin relieves pain and reduces the need for NSAIDs in OA. So concomitant need for non-steroidal anti-inflammatory drugs were decreased. Again, multitude of studies, a comparative study between curcumin and ibuprofen, and it was as effective and had better GI tolerability as compared to ibuprofen. So it has also been studied as a monotherapy, and it can be safely recommended for long-term management of osteoarthritis. They have combined it with diclofenac, and when combined provides additional benefits in the WOMAC scores. So it can be combined with multitude of agents like celecoxib. It can be combined with methotrexate and with prednisolone. It is safe because I think it's an herbal extract, and you usually take the full product, so this should be safe, shouldn't be a problem. And this is the dual formulation or novel formulation for curcumin. This is what innovation at I think the company. The conventional curcumin is poorly water soluble. It is undetectable in plasma, so you need high amounts of the dosage to have a bioavailable bioactive substance. And this is with a newer drug delivery system. There is self-micro-emulsifying drug delivery system. I really don't know how it works microscopically, but then this has to be something novel delivery system, which has everything is nano, so this is nano-sized hydrophilic particles, and this eventually enhances the bioavailability of curcumin. The dosage is about 100 to 200 milligrams per day, and it can be increased to about 400 milligrams per day. So summarizing, you can use it as monotherapy or in combination therapy, and it is safe, well tolerated and effective.